So you've been diagnosed with diabetes, and you probably have heard at this point that diabetes affects the feet to a large extent, is one of the main areas of the body that it can affect, including eyes and kidneys. You may be asking yourself, what are some of the problems that occur that I need to be looking for with diabetes in my feet? How does it affect my feet? And one of the most important things you can do, and probably the single most important thing you can do actually, as a diabetic regarding your feet, is to look at the feet on a daily basis. It's very important to look at your feet. People think, well, I wash my feet, they look pretty good to me, and that's probably as far as I need to go. Actually, it's not. Very frequently, people don't look between the toes of on the feet. They don't look at the bottom of their foot. You can ask yourself now, how often have you actually looked at the bottom of your foot in the last week or days even? The reason those things are important is because certain things begin to develop in your feet with diabetes. Some of those things can include skin breakdowns. Simple things and common things like toenail fungus, athlete's foot infections, which are not a big deal for the average person, and easily remedied, can be a significant problem for a diabetic, because diabetics often suffer from immune system depression and loss of feeling in their feet, called neuropathy, and also lack of blood flow and circulation damage to the feet as well. Those things coupled together can cause these problems to sort of spiral out of control, and then a small problem becomes a big problem. So if you can stop those things from happening before they become a big problem, it's much easier to manage these things, just like your diabetes as a whole. So you should begin each day by inspecting your feet. You should look at the bottom of your foot, look between the toes. If you have back problems or maybe a little overweight to the point where you can't get to the bottom of your feet very easily, perhaps you can have a family member or a friend help you look at the bottom of the feet once a day and help you look between the toes. Another handy tip that a lot of people will use is to have a small flat mirror that they can slide in and out from under their bed each day to hold their foot over to look at the bottom of the foot. And what are you looking for? You're looking for any sort of negative change, any sort of new callus formation, new blister formation, a red spot maybe. Any areas that you notice are painful, you want to look at those areas in particular, because that may be an indication that the skin is beginning to change, leading up to a possible skin breakdown, which can then become an open sore, which then you'll have difficulty healing. The other things you want to look for are changes in the structure of the foot. Sometimes diabetics will develop more severe conditions, hammer toes, bunions, which are common conditions across the entire population, more readily affect diabetics. They become more severe and progress more rapidly. And so you want to look for those kind of changes as well. Oftentimes people will develop small calluses, which are not painful, on the tips of the toes, the tops of the toes, along the inside of the big toe, which can become open sores, which can then lead to breakdown and then possibly an infection as well. The same thing with athlete's foot infections. That's probably one of the most overlooked things that we see. People don't take the time to look between their toes. Oftentimes the skin will become soft and moist, where it doesn't have adequate air exposure to keep the skin in its integrity intact very well, and so you'll end up with a small break in the skin, which if not treated properly can then be an open source for infection. Any break in the skin is always a portal for the infection to begin entering the body, and then it cause an abscess formation, a collection of infection at that area. And if you have neuropathy or nerve damage, you can't feel those things. You have no idea that they've developed until you're actually very sick from the problem.